I'd like to take this chance to introduce our COP, Dan Abbott, who will make some opening remarks.
Great. Thank you, Magda, and good morning, everyone. Really pleased that you're all able to join us today for Growth Through Nutrition Operations, Research, and Learning event. I'd like to start by thanking our great partner, Tufts University, who has been leading Growth Through Nutrition's operations, research, and learning work over the life of the project, and they've organized the event today. So thank you very much to Tufts, and also pleased that Professor Eileen Kennedy and a number of the team from Boston will be able to be joining us for parts of the session today and tomorrow. I'd also like to thank USAID. We're expecting our AOR and the nutrition coordinator, Jim Citrick, to be joining us. And I see a number of other colleagues from USAID that have been great supporters of Growth Through Nutrition on the meeting as well. So thank you very much to all of you and to USAID for your support, as well as to all of our partners from governments, academia, and other implementing partners that we've engaged with throughout the life of the project. So today and half day tomorrow, we'll be reflecting on some of the findings and excuse me, the lessons learned from different operations research activities that Growth Through Nutrition has undertaken. We'll also be sharing a number of studies that have been conducted more recently or have not had a chance to be presented in a learning event before. Especially the agenda tomorrow focuses on a lot of study presentations for the first time. This will actually be our last learning event with Tufts University at the lead. We'll soon be concluding their work on the project. And I think we've done, as a project and with our partner Tufts, we've done a really nice job of pivoting to these online events after COVID became our new reality. So I appreciate their work on that line and the continued really good engagement we've had over the past year. And I know that will continue today. So though this is the last event with Tufts, Growth Through Nutrition itself will continue for more than 1 additional year from now. We'll have a number of additional learning events. The project is actively working on documentation of a number of lessons learned from our implementation experience. And we'll be planning events going forward to continue to share that learning and discuss with all of you. So please stay tuned for that. And with that, I'll say thank you and please enjoy the event. Back to you, Magda.
Okay. I don't think Jim is with us just yet. Jim Citrick, are you with us? I don't think so.
Yes, I am.
Oh, you are. Okay, I'm trying to. Okay, go ahead, please. I can.
I guess for this, I will put myself on video. I don't know whether or not you're able to see me or not.
We can. Yes, thank you. We can hear you.
I don't see myself, so I didn't know. I wanted to thank all of you at Growth Through Nutrition and at Tufts for the opportunity to just make a few comments and observations at the beginning of this two-day session. As you all know, collaborating, learning, and adapting is at the heart of what USAID tries to do in its development programs. And this is highlighted by this event and by the ongoing work that Tufts has been involved in during Growth Through Nutrition since its onset. We are tremendously thankful for this particular aspect and for the opportunity it offers Growth Through Nutrition to share what it has found and what it has learned and what it has applied in the course of the activity. USAID in particular is putting an increasing focus on CLA, or collaborating, learning, and adapting. In fact, we have a full-time CLA advisor at the mission now who works with us and whose advice we take very much to heart. I'd also like to say how impressed we have been, and we continue to be, at the importance that Growth Through Nutrition places on learning and adapting to the lessons that have been obtained through this learning process. The project learning working group throughout the project has been a tremendous boon and benefits not just Growth Through Nutrition, but other development partners implementing partners throughout Ethiopia. So we appreciate that. I want to thank Growth Through Nutrition and Tufts for organizing this event, which will focus on findings and lessons from operations research during the project. And we look very much forward not only to the learning today and tomorrow, but how we can apply that learning to Growth Through Nutrition in its final year and to other activities that USAID sponsors throughout Ethiopia to make sure that our development dollars go as far as they can and are as effective as possible. I'd also like to say that I'm looking forward to what we are going to learn in the next couple of days. And I very much hope that we can take to heart the fact that learning is not necessarily meaning that you cannot fail. Sometimes you learn as much from things that do not work as you do from things that do work. Either way, you're better able to apply what is learned and what has been discovered to make projects and activities and interventions more effective for those who most need our help. I also like to take a final moment to say farewell to all of you, because I will be leaving Ethiopia next week after 3 years here and after 3 years as the AOR for Growth and Nutrition. And I wanted to emphasize to all of you with whom I have worked and collaborated, and all of you I've met and been impressed by, what a pleasure it has been to work with you, how much I enjoy your successes, how much I am impressed by your flexibility during what has been an extraordinarily trying and difficult time for all of us who work in development here in Ethiopia. And I encourage you to continue to do the spectacular and impressive work that you do to benefit our beneficiaries, to benefit the people who most need our help throughout the area, throughout the footprint that GTN has all through Ethiopia. So with that, I will conclude right now. But if anybody has any questions, please feel free to either chat with me in the chat box or email me separately. And I thank you for this opportunity to open up this conference, and I very much look forward to what we're going to learn from it. Thanks very much. Over.
Hello, my name is Eileen Kennedy, and I'm Principal Investigator for the Tufts component of Growth Through Nutrition. Let me add my voice to the welcoming that has already taken place. I am absolutely delighted that over the past 5 years, Tufts has had an opportunity to collaborate with Save the Children and our other partners. For me, what was exciting about the Growth Through Nutrition activities, both our learning agenda, but broader than that, all the activities under GTN, it was an emphasis on impact. It was an emphasis on relevant activities. And what I believe you will see from the rest of these 2 days is a description of what went on, a very rich discussion of what went on, but also the relevance, not only for the activities through Growth Through Nutrition, but I think we have results and recommendations which have clear implications for the government of Ethiopia going forward, to build on the evidence that we have generated from Growth Through Nutrition, which valuable, hopefully, for many, many decades to come. And so with that, I will say I am looking forward to a very lively discussion over the next 2 days. Thank you.
Okay, now moving forward, I would like to thank all the speakers for the great opening remarks. And now we're going to start, before we start the program for our today's event, I would like to take you through the agenda. First, Dan Abbott, the Chief of Party for Growth Through Nutrition, will give us an overview of GTN and how the learning agenda fits within the program and some of its informative role. Then I will deliver a presentation highlighting some of the key lessons learned and recommendations, mostly based on operation research conducted under Growth Through Nutrition by SAFE implementing partners and Tufts. So the first session will highlight some of the key lessons and recommendations, mostly focused on the first three intermediate results. And when we come back from coffee break, we'll have a success story where we'll get a chance to disseminate some of our project successes through videos and a narrative form. And I will also continue with the second part of my presentations, where I will highlight some of the key lessons and recommendations from the remaining intermediate results. Hope you will find the key lessons and recommendation useful for informing the remaining GTN activities as well as future nutrition programs. We will also have a chance to hear a presentation from Lu'ul Brhanu, who is the Deputy Chief of Party for the Growth Through Nutrition. He will highlight some of the innovative approaches that the project used in implementing the program, including the grant under grant program, the private sector engagement, and others. So following this presentation, we will have a 45 minutes session, question and answer session, where participants will get an opportunity to ask questions and also reflect on the presentation. So that will get us to lunch. And when we come back to lunch, we will give an opportunity for international and local partners to reflect on some of their reflections on a nutrition intervention using multi-sectoral partnerships. So the day one will mostly focus, like Dan said, overall key lesson learned and recommendations from operation research. Moving on to day two, we'll have more specific operational research conducted by Tufts, DIETARY, as well as through the small grant programs. So you'll get to hear different presentations that highlights the recently completed study assessment, pre-post agriculture and knowledge competency assessments of agriculture and WASH technology students at Higher Learning Institute from DIETARY. And then that will be followed by a presentation by Dr. Abdulik, research manager at Tufts. He will deliver a presentation on the effectiveness of an alternative SBCC approach, which is a virtual facilitator, in improving women diversity, women empowerment, some of the WASH practices. And we will also get to hear 4 presentations from the small grantees. Some of their topics include a presentation on adolescent nutrition, the effectiveness of teaching trainings on pedagogic skills of instructors at higher learning institutions, and communities' perceptions around local complementary food production and sale. And as you see it on the agenda, we have also moved one of the presentations from day 2 to day 1 to accommodate the time difference of one of our presenters, Eileen Kennedy, the principal investigator at Tufts. She will be delivering a presentation on the role of household acid on women diversity. That will bring us to an end of today's agenda. Thank you so much, everyone. Hope you will find this learning event very useful. Now I'm going to hand it over to Dan so he can deliver the presentation on the overall implementation of growth-through nutrition and informative role of the learning agenda in the program. Thank you.
Great. Thank you very much, Rahel, for that overview of the exciting agenda ahead of us. As you've indicated, I'll start with just a really quick overview of growth through nutrition for any of you who are not very familiar with the program, and then also give some highlights on the learning approach that we've used through the life of the project. We can go ahead and move forward on the slides, Jennifer. And again, yes, so for growth through nutrition, this is USAID Ethiopia's flagship multi-sector nutrition and WASH project, aiming to improve the nutritional status of women and children. It's very much designed and delivered in support of and with the government of Ethiopia, with a particular emphasis around the food and nutrition policy and the recently endorsed food and nutrition strategy, as well as the One WASH national program, and Sakota Declaration. Growth Through Nutrition is a very multi-sectoral project. So we work primarily with the agriculture, health, water, and education sectors and on multi-sectoral activities, which we'll hear more about through the agenda. This is a 6-year project, so we are in the 5th year, so it's a little over a year left to go. And the project is led by Save the Children. We do have 6 international partners, including Tufts, who've organized today's event, as well as 5 local NGO partners. And we'll have a chance to hear from these organizations today. If we move forward. So this, on the map, you can see the colored areas. This gives you just a picture of the Growth Through Nutrition implementation area. So we are working in 120 weredas in 5 regions. The population of this area is about 14 million people. And I won't read through all these targets, but you can see that we do have very ambitious targets in terms of reaching children under 5, pregnant women, supporting people to access water and sanitation, and a number of livelihoods activities, including targeted and vulnerable households. And also through our pre-service education work, working with higher learning institutions and supporting graduates. And as Rahel said, we'll have a chance to hear more about the impact of the pre-service work tomorrow. If we move forward to the next slide, this just gives another view of the different components that Growth Through Nutrition is working in with our results framework in terms of the different intermediate result areas. So we're really striving to improve access to diverse and quality foods. This is where we really work closely with the Ministry of Agriculture, here it says health, Ministry of Agriculture, as well as our partner Land O'Lakes Venture 37. The second intermediate result is about improving behaviors, basically across the different nutrition-specific and nutrition-sensitive domains. And so we're working really in all components and with all partners here. On the third intermediate results, we do have the work on the nutrition-specific activities through the health sector. And the fourth intermediate result is about providing access to safe water, as well as to wash products and services through the private sector. And we work with PSI and World Vision in this area. And the fifth intermediate result is on our strength in government leadership and capacity. And so this is our efforts on multi-sector coordination, as well as the work with universities that JPIGO leads. And a number of cross-cutting areas. I've highlighted the one that we're really here to focus on today, our research and learning, which is led by Tufts, but also have a number of activities on gender and layering and convergence, as well as a crisis modifier for emergency response built into the project. To move forward. Now we'll just touch quickly on some of the highlights of the learning agenda that we've been implementing over the last 5 years. I've also included our project learning website here. If any of you are not yet familiar with that, I do really encourage you to check it out, as you'll find most of the resources from the project available there. We can go ahead forward. So the learning agenda of Growth Through Nutrition, as we touched on earlier, this has been led by Tufts University, who designed the approach in collaboration with Save the Children and the other partners on the project. And the agenda really is trying to drive learning and adaptation, both from implementation experience, as well as from focused operations research. And then, of course, through events like this one, to be sharing learning with additional partners and having discussion, debates, and good conversation around learning. The Growth Through Nutrition work does link to other existing learning platforms in the country, including those led by EPHI. And then there's different major components of the learning agenda. One that we'll be seeing a lot from today is the operations research. So Tufts' role on Growth Through Nutrition is they led a number of operations research, about 10 studies throughout the project. They've also supported Save the Children and the other partners on Growth Through Nutrition to design and effectively implement a number of other focused investigations or assessments to inform the project. And we will have a chance to learn from some of those in this event as well. If we just move to the next slide, I'm not going to read through this, but these are the list of the 10 studies that Tufts has done. I've just kind of bolded a few words to give on our quality improvement initiatives in the health sector, on agriculture, looking at some of the barriers and facilitators of healthy food, production, purchase, and consumption. We have had a study on our SBCC communication approaches, namely our enhanced community conversations. Also did a study around the impact of COVID-19. We've done on the effectiveness of the WASH committees on the WASH component of the project. We've had a couple of literature reviews in the early part of the project on behavior change communication for nutrition. And then also have recently done a couple of secondary data analysis studies that were actually drawing from data from Growth Through Nutrition's predecessor, the USAID Engine project. The two studies that are underlined, one on the SBCC and one secondary analysis on the role of household assets, those will both be presented in full during the event. The other studies, as well as a number of others not shown here, will be also have some lessons pulled from in the event as well. If we move to the next slide, I'll just touch quickly on some of the other areas on the learning agenda. So for knowledge sharing, we've done a number of learning events, such as the one we're on today. As I touched on earlier, these were initially in-person events, and then we have since, over the past year or so, a year plus, shifted these to online events, and that's been quite successful and enabled a wide participation as well. So that's been really great. As I touched on earlier, we also have our project learning website, which is gtn-learning.org, where you'll find a lot of information, and you'll find the full details on a number of studies, as well as other project events and documents of relevance. And then through the project, we've also developed a number of policy briefs and learning documents. More than 20 manuscripts for publication in journals have been prepared during the project, again, including some from support provided during the predecessor project when we did support a PhD program. So some of the supported some students in their PhD program. And so some of the manuscripts have been produced by those doctoral candidates or PhD holders now. And then if I go to the next slide, another interesting area that I really like is our distance learning modules. So this is a Tufts, as an academic institution with a lot of experience, obviously, in education, has really drawn on their staff and expertise in online education and developed 11 online courses that have different technical and programmatic focuses. These are available for free through the project website. They are targeting government staff as well as academia, researchers, and other implementers. It's largely targeted at the Ethiopian audience, so it's available to any. So more than 550 courses have been completed with certificates awarded so far. So do encourage you to check that out if you have not done so already. And then moving forward, we're working with Tufts University and the Academic Center of Excellence in Nutrition to transfer the hosting of these courses to Tufts University so that they'll be available in the long term for free to the Ethiopian nutrition community. Another area that we have done in terms of capacity building is a small grant program. So we've provided financial and technical supports to local researchers to conduct focused operations research on different nutrition topics of interest to the project as well as to the nutrition community in Ethiopia. And tomorrow we'll have presentations from 4 of those. And then the last slide is just to give you a quick look at these are the topics for the online courses if you've not previously checked that out. So it's quite a range of different areas of interest. Some of them are quite pertinent areas of focus in the country now, including on food systems. So I won't read through all of these, but just to make you aware if you've not previously checked that out of this really nice resource. So I think that gives a good highlight of some of the different areas that Growth Through Nutrition has been working and where Tufts has really played a leading role over the last 5 years, different types of resources that are available. And we'll hear more about some of those over the next couple of days. And again, much more detail and the specific study reports, et cetera, are available on the project website. So thank you for your attention. And now we'll give it back to Rahel to start to go to some of the specific findings and learning. Thank you.
Thank you, Dan. Now we are going to move forward with sharing the presentations on major lesson learned and recommendations from operation research conducted under GTN. Okay, Jennifer, I think would you mind uploading? I don't think I have permission. It says disabled.
Okay, sorry about that.
It is the one that says part 1.
Okay, let me give you, I can do that.
Or Magdalawitz for, okay.
Do you see it okay?
I think it's a little bit blurry.
Okay.
Magdalawitz, can you try upload it from the side, from your side?
Okay. Our apologies for the slight delay. Just a quick reminder, please make sure that your screens are. Rahel,
Okay.
better?
Yes.
Great.
Right. Okay. Thank you, Magdalawitz. Yes. Here's the. I think we have a background noise. Okay, here is the outline of my presentation. So I will share by giving a study overview, a lesson learned and key findings, as well as how we adopted some of this adaptation mechanism and recommendations for the way forward. Next slide, please. Yeah, the first study that I'm going to be presenting is the cash transfer study. This is a study that was conducted during the early stage of our project implementation. It assessed the best modality for delivering agricultural inputs such as sheep and goat as in-kind or cash to project beneficiaries. The study was piloted in 2 districts in Amhara and Oromia, and the data was conducted using interviews of most vulnerable households and FPGs with extension workers, as well as key informant interviews with finance persons and field operation. Next. Yeah, so what we learned from the implementation of this study is that the cash transfer was found to be a better mechanism than in-kind transfer of sheep and goats to beneficiaries, mainly in terms of the quality of animals purchased, distribution sites seems to be closer and convenient to our beneficiaries, as well as effective use of time and resources of our beneficiaries, government support, and project staff. On the other hand, cash transfer had a risk of mismanagement of money transferred, and it also has a limitation in the initial animal sales provision and data collection as compared to in-kind. As you know, during in-kind approach, the animals are delivered after vaccinating them to the beneficiaries. But in this case, I think it requires more of a monitoring, close monitoring to see the timely purchase of the animals as well as health service provision. And the study also indicated that beneficiaries, can you go back, please? Sorry. Yeah, the beneficiaries who purchased animals through in-kinds are more likely to sell their animals than beneficiaries that purchased animals through cash transfer. This could speak to the inferior quality of animals purchased through in-kind or committee purchase. Next. So the way we adopted is the project is currently implementing cash transfer approaches in selected areas where beneficiaries have easy access to bank, or where in areas where there is no risk for project staff to carry large sum of money in hand. The current post-distribution management study will also give us additional insight on how well such approach works. So our recommendation forward is it's very important that we put in place an effective livestock distribution, which takes into consideration the feed availability, the costs of livestock, the costs associated with livestock. We want to distribute them. We want to distribute the cash during the time where the cost of livestock is reasonable or affordable, and also a strict monitoring system that ensures timely purchase of good quality livestock by our beneficiaries, and also that they provide the necessary health services. Okay, next, please. The second study, this is also conducted during the early stage of our project implementation. We call it a seasonal calendar study. Next, please. This study, which was conducted in 2017, assessed the seasonal food production, availability, and consumption practices of most vulnerable households and model farmers. Most vulnerable households are economically poor family households who experience at least 3 months of food gap. And model farmers are, on the other hand, a little better off, economically better off community members and farmers. So the project provide inputs provision to most vulnerable households, whereas only provide technical supports for model farmers. And so this study assessed the type of food production, the availability, and the consumption practices of these two groups residing in the 7 major agroecologies of the project intervention waradas. The projects applied purposely selected 10 AGP and 8 PSN waradas, or food insecure waradas. And the data collection was conducted by interviewing model farmers, vulnerable households, waradas, and also key informant interviews with market experts and FGGs with male and female farmers. Next, please. So some of our findings shows that the waradas, even in one agroecology zones, have different crop production calendar, which is they prepare their lands, plowing, harvesting, and threshing in various months of the year. This is mainly due to the difference in the onset and length of rainy season. This is one example from Wainaidaka agroecology. The different waradas that are highlighted in different colors, as you see it here, have different onset and length of rainy seasons. For example, if you see the 3, the middle ones, the orange, the blue ones, they relatively have the same onset and length of rainy seasons, whereas the warada like Horo, it has a very short rainy season, dry season, and long rainy season, whereas Wangwa has a very long dry season and short rainy season. This means that these waradas, even in one agroecology, have different kinds of crop production calendar. Okay, next, please. So having different kinds of crop production calendar can be an opportunity for producing and labeling different kinds of fresh produce throughout the year. Another key finding is that the type of crop production, as I mentioned earlier, and also consumption greatly varied across the different agroecologies, and mostly it was dependent on also the consumption habits of rural households. Consumption decisions were not mostly made based on nutrient value of food, but it's based on consumption habits. Rural households mostly have a small plot of land, and the current traditional and rain-fed crop production practices makes it very difficult for all year-round production and supply of adequate diversified food. So most vulnerable households, even model farmers, were unable to fulfill their food requirements from their own production. So market plays a significant role in making some of the nutrient-dense foods like fruits, vegetables, and animal source food accessible for our beneficiaries. Although the consumption of these food items still remains to be very low. Okay, next please. So the way that our project adapts based on this finding is that the project designed an agroecology specific resource package to increase access to diverse, safe, and quality food, and also promoted purchase of nutrient-dense food when our beneficiaries could not meet it through own production. GTN also developed a menu of balanced diet based on the study findings and used the menu for provision of various NSA trainings, cooking demonstrations to extension workers, as well as nutrition counseling at health facilities. In addition, the project has introduced a few post-harvest technologies useful to extend the shelf life of fresh foods and increase their availability during the dry season, some of which include solar dryer technology as well as zero energy cold chamber. So our recommendation is that it is very important to design nutrition sensitive off-farm activities for our beneficiaries with a small plot of land and promote scale up of different cropping systems and water-saving irrigations, taking into consideration the different contexts and different agroecologies. The SBCC intervention should also emphasize more in creating awareness around nutrient value of food to support food production and consumption decisions of households. We also recommend that future nutrition projects promote the establishment of market and creating market linkages and sharing market information to improve access to nutrient dense. And also this will be an opportunity for some of our beneficiaries to sell when they have excess produce and generate income. Okay. We also recommend introducing affordable labor and time-saving post-harvest technologies. In our findings, we find out that some of our the project intervention Warada have very long rainy seasons. That means that they do multiple cropping activities for several months within a year, which requires a lot of labor. So our beneficiaries will be spending, mostly mothers, on the field trying to support the crop agriculture activities, taking some of their time away from child caring and feeding practices. So having advanced technology, labor, and time saving will help them to save their time for child caring and feeding practices, as well as other nutritional activities. Next, please. Okay, moving forward with the second component of our project, which is mostly focused around improving nutrition behavior and practices among our target groups. The adolescent nutrition related conducted a formative study on adolescent nutrition. As some of you might know, there was a study that was also conducted on adolescent nutrition, but this study is done to give additional information on adolescents out of school, adolescents and nutrition practices, their relationship with their family members, friends, peers, as well as some of the barriers around fasting and misconceptions around food or menstruation, and also some of the gender related aspects. So this study was conducted to give additional information to what we already know by conducting the study, adolescent nutrition study during ancient time. Next slide, please. Yeah, so the study was conducted using FDDs, mostly talking with parents and girls, best friend, interviewing their best friends, direct observation, as well as in-depth interviews with parents and mothers. So the study participants include almost around 260 adolescent girls, which include both young adolescents and older adolescents between the age of 10 to 14 and 15 to 19 respectively. Next, please. So what we learned from this study is adolescents usually eat with their mother, and generally their diet has little diversity. And this findings was consistent across all the regions that the study was conducted. A lack of access to nutrition food, food taboos mainly in Amhara, fasting, especially common for older adolescents, prioritizing father and male family member for nutritious food were barriers for adolescents to consume nutritious foods. We've also learned that adolescent girls have much more influence in their households, mainly around the planning and preparation of meals and on some of the health and hygiene practices, but they have little influence over the type of food that their family produce. The study indicated that schools, health centers, community assemblies, places of worship, especially for out-of-school adolescents and parents, are major platforms and channels for reaching adolescents with nutrition-related information. Next, please. So we've used the findings from this study basically to promote the whole household approach as a major SBCC strategy of the project. The whole household approach generally advises the households to consume and produce nutrient-dense foods, but more attention will be given to the vulnerable member of the households, mainly mothers, pregnant mothers, lactating mothers, and children under the. So the project also developed specific SBCC tools that help to address some of the adolescent nutrition knowledge and practice gaps in line with the findings from the formative research. So moving forward, our recommendations include ensuring the integration of the new SBCC package in the NSA and MICN trainings to frontline workers in and out of school platforms, as well as close monitoring with the focus on behavior change, gender roles, and family relationships. And we also recommend a meaningful involvement of relevant government offices to ensure proper transmission of SBCC messages to households, to in-school and out-of-school adolescents in a sustainable manner beyond the project period. Okay. Our next study finding is the maternal nutrition and dietary behavioral study. Next, please. This study aims at generating evidence and device to help women, including adolescents, improve their dietary practices during pregnancy and lactation within the socio-cultural context of Ethiopia. The study applied a trial of improved practice. This is, some of you might be familiar with this, it is a qualitative research which consists of 3 household visits to selected women to review some of their nutrition practices and identify gaps, and also discuss potential ways of improving and providing recommendations. And on the 3rd visit, the researcher will go and see if some of the recommended practices have been implemented and sustained. The study participants include pregnant and lactating women and older adolescent girls from 6 waradas of the 3 study intervention regions. Next, please. Okay, so what we found out was the adolescent and women eat same food as the rest of the family member, and they have diets. The recommended trial of nutrition practices generally helped to improve the diets of adolescent and pregnant and lactating women. Some of the easily applicable practices were adding eggs, consuming green leafy vegetables, adding tauba, which is mainly common, which was mainly worked around adolescents and lactating women, and also including easily accessible fruits in their diet, mostly banana. And the pregnant and lactating women, low awareness, limited access, balanced diet, misconception on some of the foods, long fasting seasons were major barriers identified as a gap. And women feel ashamed to prepare or eat a separate meal different from the rest of the family. So I think recommending women to prepare additional meal was not a doable action, but instead eating snacks between meals was a more successful approach to improve their diet. And most women, unlike adolescents, regardless of their status of pregnancy, usually carry heavy workload and get very limited support from family members, except during recuperation period, which is around 5 days after giving birth. So the program adopted some of the findings from the study to inform again the program SBCC strategy on doable maternal and adolescent nutrition interventions, and also developed ECC materials and health facility counseling materials in a way that it addressed some of the gaps identified and leveraged some of the good practices identified in the study. So our recommendation is identifying doable nutrition practices by local experimentation of widely recommended nutrition practices, the same way that we applied in the trial of improved practices can be an integral component of future nutrition practices. And we also recommend promoting local recipes and adequate consumption of nutrient-dense food by building the capacity of nutrition workforce on the practice-based evidence generation for locally effective SBCC intervention than directly adopting national guidelines. Next. Yeah, next, this study is a component of the health and nutrition component of our program. We call it a quality improvement study. Next, please. Yeah, this study assessed the role of 2 quality improvement interventions, mainly model for improvement and Kaizen, in improving the nutrition service at primary health care units, and also identify challenges in facilitators of implementation. This study was conducted on the 3rd year of a project implementation. So after implementing these 2 interventions, we wanted to know the status of implementation and what some of the challenges and facilitators these initiatives. So to give you an idea of what model for improvement is, it's basically, it has different steps of identifying problems in relation to provision of quality health services, and it conducts root cause analysis to identify what's causing the problem, and then come up with innovative solutions and implement different activities, and constantly measuring, setting goals and measuring our indicators frequently to see whether we are moving towards our goal or we are making any progress. So this is mostly used for improving quality of health services at primary health care units. But the project has also started implementing pilot testing some of these approaches in farmers training centers and other institutions. And the Kaizen uses a 5S principle, which is mostly around sorting, organizing, keeping documents clean, the health facility environment clean, so that it becomes user-friendly, both for staff as well as for clients. So this is the approach. So the study used mostly a cross-sectional design with mixed method, and by randomly selecting 22 primary healthcare units, implementing QI in the 4 project implemented regions. We have used key informant interviews, focus group discussions at the health center, health post, and carried out this. Next, please. Yeah, so one of our key findings from our study is that when we look at Kaizen, it was universally implemented across health centers and health posts. As you see it here, over 95% of the health posts and health centers implemented Kaizen. But when we look at the model for improvement, we see that it was predominantly implemented in health centers, but not so much at the health post level. Found out that only less than 40% of the health posts implemented model for improvement, whereas 91% of health centers implemented model for improvement. Next, please. The other component that we looked at is looking at the not only implementing model for improvement, but also the availability and functionality of QI teams at the health post. Now, we wanted to look at the composition of the QI team members, and we also looked at how often the QI team members meet to discuss and also measure some of their indicators as a way of tracking their progress towards their goal. So again, we see that, again, in terms of availability and functionality of QI teams, we see there is a better performance in health centers as opposed to health posts. The ones marked in red are health posts. We see that, they don't meet often. And the QI department, the QI focal person, they don't have QI focal person at the health post level, or things like that. So that shows that even when the QI team functionality is not effective, okay, at the health post level. Yeah, this is the graph that shows us that when QI model, like the model for improvement, is implemented, it helps to improve and meet targets, different health service targets. For example, this is one of the health posts at the SNMP. They had a plan to improve vitamin A supplementation from 50% to 80%. So they identified different kinds of root cause analysis, and they implemented different interventions, including health development army mobilization of the community. They measured the indicator every month, track the progress, and when they see a lower performance, then again they implement another intervention or innovative idea, which is, for example, here they reorient the QI team through review meetings, and then they came up with the third innovative approach of improving health extension workers and HDS linkages. So the combination of these interventions helped to improve the quality of service in terms of vitamin A supplementation, and they were able to meet their target by the end of the year. And one thing very important is quality of improvement or model improvement is not only meeting the goals, but also ensuring that targets are sustained over time. Okay? So some of our adaptation mechanisms were, there were more emphasis given for model for improvement approach, mainly at the health level. For instance, there were more frequent coaching and primary healthcare unit review meetings discusses around some of the challenges around and success around model for improvement at the health post level, and also the strengthening of linkages between health centers and health posts so that they can get more support, the health board get more support and guidance of the health centers. The other finding is that the QI study findings has been shared with the Ministry of Health and also using various platforms, including the recent QI summit. And some of the findings were useful for informing national healthcare quality strategies and health extension directorate support of QI at all levels. Additional monitoring indicators on QI also added to the project DHIS data to track performance and the adoption of QI approaches, as well as included QI on the quality of care and MNCH. So our recommendation is there is a need for additional strengthening of quality QI support from the Warada Health Office to the health centers and health centers to the health offices. Emphasize in institutionalization of QI, and one way to institutionalize this is by including QI in the formal roles and responsibilities of healthcare providers at the health facilities. There is also a need to give more attention to the monitoring system that allows timely assessment around the QI implementation progress, as well as standardizing documentation for both Kaizen and model for improvement. Okay, thank you. Okay, this is also a second operation research that falls under the same IR. Please go ahead. Please, next slide, please. Yeah. As you all know, the COVID has impacted different sectors in various ways. And this study tries to assess the change in key health and nutrition services at primary healthcare units and on agricultural activities during the COVID pandemic. The pandemic hit our Ethiopia sometime like at the early stage of the pandemic, which is March to July 2020. So the study looked at the project intervention Warada's primary healthcare units at the project supported Warada's. And the way the study was conducted was they compared key health and nutrition indicators, compared March to July of this year with the pre-COVID time of the same study period, which is March to July of 2019, and to see if there is any difference in the performance of the health and nutrition services, in the provision of health and nutrition services. This was also accompanied by qualitative data collection using 10 key informant interviews with health center heads, health extension workers, Warada agriculture officers, as well as PTN as well coordinators. Next, please. Yeah, as we all know, there are a number of mitigation strategies that are put in place to decrease the negative effect of COVID on various project interventions. Some of this include creating awareness on COVID prevention. This was a common intervention both at the health and agriculture sector. There was a strong implementation of infection preventions, mainly around availing personal protective equipment, medical supplies, and this was also mostly common at the health centers, and using volunteers for mobilization and delivering some of the services. This was common among the health posters mainly. And other mitigation strategies include careful movement of labor in agricultural sector. But despite all these mitigation strategies, we still saw that maternal health services, such as institutional delivery, maternal deworming, IYCF, maternal nutrition counseling, ANC1, IFS implementation were all lower in 2020 as compared to 2019 at the health facilities. This, as you can see, there was a lot of fear around affected by COVID, so people were reluctant to come to health facilities to deliver, to get some of these services. When we look at child health services, the gross monitoring treatment of severe acute malnutrition in the area decreased in 2020 compared to 2021. But whereas when we look at vitamin A supplementation and under 5 nutrition screening, it has increased in 2020 compared to 2019 from the previous year. This could be related to some of the services where could be done with an outreach program, so that minimize the effect of the COVID on some of the delivery of some of the services. Next, please. When we look at health costs, mainly the vitamin A, under 5 screening for malnutrition and deworming was generally very low throughout the study period, which is March to July. But when we look at again vitamin A and gross monitoring, the impact was more visible during the early stage of the pandemic, which is from March to April. But starting April, some of these services started improving, and even gross monitoring became the same performance level as the previous year, as you can see it from the graph here. Next, please. Yeah, when we look at maternal health services, malnutrition screening, INC, deworming, and IFTC supplementation, women conference and cooking demonstrations were lower in 2020 than in 2019. This is activities that require group gathering as opposed to other services such as IFA malnutrition screening and NSC continue to show slow improvement even at the later stage of the pandemic. Right, next please. Okay, now moving forward with the agriculture and GTN livelihood intervention. Yeah, we saw that support from agriculture extension workers, marketing of produced goods, accessing agriculture inputs were the most affected agricultural activities. When we come to our project livelihood intervention, promotion of NSA, mainly in schools, organizing most vulnerable households into village saving groups were the most affected. This, as you can expect, because of the social distancing, it was not possible to gather large number of members, as well as the schools were closed. So this had an impact on some of our livelihood interventions. Whereas the provision of technical support to model farmers, mentoring and coaching at FTCs and schools, and a follow-up of village saving groups were moderately affected. Next, please. So our adaptation process is like the project supported COVID-related SPCC activities to address some of the perceived causes that affected the health services delivery. For instance, it developed and distributed standardized COVID SPCC materials to frontline workers, promoting COVID awareness for some of the existing project platforms, including ECC and house-to-house visit. So our recommendation is that the pandemic, such as COVID, has a potential to reverse some of the nutrition schemes that are made over the last years. So future nutrition projects needs to embed a plan to launch investigations as a component of their response and crisis modifier that helps for local evidence-based support in mitigation of future pandemics. Thank you so much I have finished with all my presentation. Now it's time for a coffee break. We'll have